Thanks so much, Susannah and DJ, for joining us today. So I want to start with just kind of a simple question: is why does it feel like innovation is so slow at the intersection of government and technology and health? I mean, you see sort of how rapidly the iPhone has changed things. You know, you see companies like Uber, which have grown, massively and disrupted transportation in the past 5 years. What's happening in this other world?
One thing that I've noticed, and this is true, I think, of anybody in healthcare, that there's perverse incentives, that we really don't have an alignment of the market where patients and clinicians and payers really want to adopt any technology that keeps people as healthy as they need to be. And we're trying to change that. But so perverse incentives is one point. The other point is that in any other industry, in lots of other industries, you can have a soft fail. You can create something that can fail. And that's not really an option in healthcare. So if you're going to create a piece of software that tracks people, that's for a clinical trial, that's for an electronic health record, you really need it to be perfect, because that's what healthcare has to do. Failure is not an option. And so engagement, sort of health engagement, is the one area where people can have that kind of experimentation and failure, but that's really only a small slice of healthcare. So that's one thing that has really held us back, I think.
Yeah, I would agree with everything Susannah says, as usual, as you'll see soon. But the thing that I've discovered also, because I'm not from the healthcare space, and so I'm coming into this with a very fresh set of eyes, and really from the world of building consumer and enterprise technology. And so one of the things that's really struck me has been just how hard it is to convince people to have a conversation about what your problem trying to solve. Most of the time you go to the hospital and you're just like, what problem are we trying to solve? It ends up being about a dollar sign, rather than the first problem, which you typically see in most problems out here, is like, we're trying to solve a problem for the user. It's a classic. If you're in consumer internet, you're not asking yourself, how do you make money first? You're asking yourself, how do you scale? How do you create engagement? How do you create a value proposition? And then it's like, well, if we do that properly, monetization will make sense, and it'll all work itself out. So we have to switch that perspective of dollar sign to solving specific problems. What does it mean, as you said, for the patient, for the provider, for all these people? There's also the other one, which is, I think we're very used to taking pride in our technology. And there's something that is really interesting. We were just talking backstage about, like, how does your environment make you feel? Like the way, like the architecture makes you feel. I think also the labels we use to define ourselves matter. So in healthcare, people are very proud to say, hey, I'm in IT. Like, those of you that are here in Silicon Valley, right? If you go into your tech shop or a company and you're like, hey, I'm in IT, it doesn't go over so well, right? And so we're technologists, we're designers. We do stuff that's different than just information technology, where we think of that as back office. So we have to take the stuff that's back office and make it front office. The CEOs and the other people who run these institutions need to become technologists, and we have to help them figure out how to become technologists. If we can have a president that's a constitutional law professor be this technologically oriented, we certainly as well can do it for a hospital.
Do you think healthcare.gov was like kind of a wake-up call in some ways for the government?
So I should say that one of the projects that the HHS Idea Lab, where I work, one of the projects that we work on is something called Buyers Club, and it grew out of and I always hesitated at HHS to even say healthcare.gov. It's a little bit like saying Lord Voldemort. I sort of want to warn people, like when we're in a meeting where we're talking about...
That's why you use the word Tom Riddle.
Right? Like, I'm going to say a word. You guys need to brace yourselves. I'm going to talk about healthcare.gov. And really what that was a failure of government procurement. For people who are not technical, the way that I describe it is that 20 years ago, if you were setting out on a road trip, you might go to AAA and get a triptych. How many people in the audience remember triptych? So then you would sort of know the roads that you were going to take. And then 10 years ago, you might punch it into, some kind of map software, and you would have your route, but it wouldn't be responsive. Now we have Waze, or pick your own app. And what's great is that it responds throughout the day. So if there's an accident on the New Jersey Turnpike, it'll route me to 295. It'll warn me. And so what we had is a situation where we said, here's our goal. We're gonna drive from DC to Massachusetts, and we don't know how we're going to get there, and nothing's going to change in between. We're just going to buy 95, and you have to stick with 95, even if there's an accident, and you're just going to sit there. Whereas modern government procurement, the way that we are trying to innovate with Buyers Club, is to stage it, and to make sure that any company that is pitching to us understands we understand what they're capable of, and they understand really what we want. And in that way, we can kind of be responsive. And the really great thing about that is that more small businesses are able to get into pitching government for their products, because they're more likely to be able to, sort of bite off something they can chew. And so I think that is something that healthcare.gov, one of the lessons that we learned with healthcare.gov.
We use the term healthcare.gov all the time, and we use it as a rallying cry, because it's a lesson that we should never ever repeat failures like that. I mean, we had to come to grips with the fact that that waterfall process done that way with procurement systems just is always a recipe to failure. The problem that we have to also come to grips with is that healthcare.gov was a small failure. We've had substantially larger IT failures, and that's unacceptable by any means, because all these things are critical systems. So that led to this awakening of saying, oh my gosh, we get it. That created the U.S. Digital Service, 18F, even my role, and we've never looked back. And I think what we're now asking is, how do we go from 1x where we are right now to 10x to 100x of this? Just yesterday, the U.S. Digital Service in 18F just released all the web design recommendations for the federal government. You're sort of like, wait, there's no style guide for the federal government, or sort of things? And there's, of course, some portion of it that's agency-wide, but how do you think about best practice when you're the U.S. government? Because your customer may have a disability, a hearing disability, a visual disability, some other thing. How do you make it available and accessible to everyone? And that notion is something that technologists also have to bridge the gap to appreciate for what it means to build for the country. We have a saying on our team, which is, we think of a technology as neither radical nor revolutionary unless it benefits all Americans. And when you start applying that statement to a lot of things that we take for granted as very simple services, they actually become much more complex. The edge cases matter, because in the edge cases, that defines quality of life, oftentimes defines life or death for an individual.
Yeah, you brought up a good point, which is that, there's never been a time where there's been more people like you, technologists, in the government. There's sort of been a wave of people from Silicon Valley going into government jobs. Either the nature of the government, and certainly the presidential portion of that, is that these are 4-year terms, these are 8-year terms. And I'm just curious, how do you keep some of the changes that you're both implementing beyond Obama's presidency, which will change next year?
Well, maybe I'll start and we'll switch, and we'll see if you agree with me. So one of the things that people don't realize is a massive portion of the data science movement actually started in the U.S. government. All of us were in data-related areas, most of which was national security related because of 9/11. That's where we got our training. That's where we learned how to do things. That's where we learned to work with data. We came out here, but we're also seeing a lot of people who are going back not to just the political kind of roles that we have, but also deep institutional roles where they actually own a problem over a course of trajectory of a career. One of the most rewarding and powerful things that I've seen is the number of people who want to stay within an agency or are already doing the right thing, and all we're doing is uplifting them. We're giving them a vector. And in fact, the role that Idea Labs plays in this is exactly one of the things that we highlight is like, if you have a great idea and you've been trying to figure out how the heck I do this, and a lot of people think like, oh, that just sounds like the government. That's every company, right? But you need some type of champion that is going to help you bring together across different portions of the business, the company, et cetera, and accelerate you. When we do that, we empower the individuals from within. And so one of our biggest things right now to do is find and empower as many of those individuals so that this notion of technology and data-driven is intrinsic rather than extrinsic, bringing it in.
I agree, which is too bad because I really think it's better if panelists disagree on something. So we're gonna disagree on something at some point. But because what I was looking forward to is you mostly talking about U.S. digital service, and then I was going to talk about agency. But I love it that you see the same thing that I do. That the political appointees are kind of renters, and the career staff are the owners. Like they're the bedrock. They're the bedrock of these agencies, and which is why in the HHS Idea Lab we have programs where we bring in outside entrepreneurs and outside innovators to work on a specific problem because they have a specific skill set. That the agency, and by the way, the agencies, I sort of think about it like the agency puts up a bat signal. The agency says, we know, for example, that the organ donation tracking system is broken. It was handwritten labels during organ procurement. And so they came to the Idea Lab 3 years ago and said, we need someone who's a logistics expert. And they actually specifically said, could we get somebody, maybe you could find us somebody from FedEx. Well, we actually found a logistics expert, 25-year veteran of UPS. And he had a personal connection. His brother had been an organ donor. And so he came in and has revolutionized the organ donation tracking system. And so that's wonderful, where an agency can come to us, put up a bat signal, and somebody comes in. But really, what I love is that there's superheroes who don't live in Silicon Valley. There's superheroes who live in DC, who are within the agency, who want to learn about lean startup methods and design thinking, and how to be customer service driven. And that's what we also do within the Idea Lab.
How do you find those people?
So we run a series of programs. One is the Ignite Accelerator program, and it's a competitive program. You apply to get in, and the most successful teams are interdisciplinary, and they attack a really specific problem within their agency. And we've had participation from all our operating divisions, CDC, FDA, NIH, Indian Health Service, regional offices, and they pitch a solution. And the most important moment is when it's kind of like Y Combinator for HHS. And the most important moment is they get to our boot camp, and they think that they got in because of their solution. And we say, nope, that's not it. It's because you identified a great problem. Because that's the most important thing for entrepreneurs, to look at a problem that can be solved, that they have a passion for solving. And so we train them up. And really what we do is we kind of give them air cover. And we allow them to work 50% of their time for 3 months on this problem. And we give them the skills. And even if sometimes we have a great win, but even if it doesn't work, even if it is a failure, this person can't go back in the box. They can't go back to the way they used to do their work. And what we really hope is that it's like an infection that we want to spread throughout HHS of really understanding how it is to be customer service driven. And so that's one way that we do that work.
I'm curious, in terms of the pipeline of engineers, so one sort of, I think, misconception is that there are no real talented engineers in the government, and that's, I think, from what I've heard, not reality at all, right? There are quite a few talented technologists and engineers internally. Just more broadly, even DJ, how do you find them? A lot of companies will be constantly tracking their engineers to see how well their code is performing and things like that. Does the government do the same?
It depends on the agency, and each agency is responsible for the way they do it. Here would be the general arc that I've seen is, we're having a very good and a long overdue conversation here in Silicon Valley about diversity. the most diverse technical teams, racially, gender-wise, are in the government. I can't, it is so amazing to see people who, in these roles who are kicking ass, who got rejected from pick your favorite company out here because they couldn't get there, and they're destroying it. They're just amazing. They are rock stars, and they're working on problems that are saving lives literally every day. It's like it is. On some side, I'm like, ooh, thank goodness that like they came and saved this problem. What I think one of the things that's there that is a challenge that we really have to work on is there is a ton of both generational technology divide as well as technological gap on procurement. So one of the classic ones right now is cloud and cloud services. Like we look at the world and we're like, wait, is that a debate still? Now, in the government, there are particular areas where there are either laws or other aspects that prevent you from just taking your basic cloud infrastructure, and we have to fix those. There's no other way around it. But the other side of that is how do we constantly institute better practices? You know, that's one thing that we do extremely well out here is we're all about the tooling. We're all about making better practice. We're making ourselves, we pride ourselves in being lazy and finding technical solutions to fire ourselves out of a job and make something easier. We have to allow that to happen and make sure there isn't some type of procurement gap that prevents us from staying as close as we need to the technology edge, or the edge of innovation that's happening.
Let's talk about the data sets and what you guys are doing with that and opening that up. Just share a little bit about what's going on with that, and then I'd love to hear, like, how is that helping? You know, how would that help anyone in this audience?
The first CTO of HHS, Todd Park, he came in and recognized that the government was essentially sitting on almost like an oil well of a resource, and that is the data that we hold. And by opening up those data sets and essentially creating an API for government health data, we weren't sure at the time what was going to happen. And what happened is that there's now a community, there's now an ecosystem of all kinds of startups and entrepreneurs and actually government analysts who use those data sets to look at population health in a way that we can see patterns. And I sort of look at data as a way to scan the landscape and kind of map the hills and valleys of population health. And there's some really interesting startup companies, for example, Roadmap is one that looks at a certain population and is able to stratify how people are doing in terms of diabetes care, so that then they can advise hospitals in the area and providers in the area to make sure that they're stratifying their approach to treating that population. And what we really want to do is open up all the spigots of data. So, for example, we want to make sure that people have access to all the data at the FDA, at CMS, so that again, people can see the population level, but we're also doing it at the individual level using Blue Button, which started at the VA, and now Medicare beneficiaries have access to it. And we have an entrepreneur in residence who's creating an API for Blue Button.
Can you explain what Blue Button is?
So Blue Button, this was another one of these ideas that people sitting around a table talking about what is the possibility of health data. And it was Peter Levin, who was then the CTO of the VA, and Todd Park, CTO of HHS at the time. A group of us got together and we're talking about what is the possibility for electronic health records that are held by the government. And nobody actually remembers who, said, well, what if there was a blue button? What if there was just a button that you could press on a website and get just a simple download? And it could be something so simple as a medications list or the last time you got a flu shot. And so that's how Blue Button started, and Peter Levin implemented it at the VA, and then we did so at CMS, at Centers for Medicare and Medicaid. And I sort of think about it like a cat door into CMS. Like you're kind of slipping in and out. It's just individual access to this data. And what we want to do is upgrade it so that it becomes an API. It becomes so that the person downloads the data and then can direct it to an app. And so it's a way for that person to have some control over the data, because that's a big question right now about
Right.
control and ownership of data.
Do you guys think about some of the sort of ownership of health data efforts that have kind of failed? Like, for example, Google Health, that didn't gain as much traction. So I'm curious, are you guys thinking of ways in which to kind of remedy some of the problems that other past people have had with that?
Well, one thing I'll say, just to stay on Blue Button for a second, is that Blue Button is actually a really, really modest program. And so in a way, it's kind of the minimum viable product that we might offer to people. And people didn't know how that was going to go. They expected maybe 25,000 downloads. We got 250,000 downloads, and we're up to 1 million downloads now. So this is something. And by the way, this is the veteran population. This is the Medicare beneficiary population, and it sparked this understanding of what could happen if you give people just simple access to something, and now we want to sort of upgrade that a little bit.
So maybe a few things here. So the mission statement, when we're defining the mission statement for the chief data scientist, the mission statement is to responsibly unleash the power of data to benefit all Americans. And so it's a super simple thing. It just has responsibility in it, unleash it, and get it out to all Americans, to benefit all Americans. One of the things for this group is if you're looking at the CMS data, or you should be looking at the CMS data now Brennan is releasing, because it tells you where the market is, and it gives you the clearest snapshot of how to think about the ecosystem at this point. It's the first time that we're even having these things. And so my perspective is I would love to see Niall and the team open up more data. I would love to see more of it opened up. I would love to see more, not just opened up more, but also regularly updated and accessibility there, and making it at no cost or extremely low cost. And the reason for that, and I'm sure Niall will see all the tweets and will get a call, which is good, so you can tell Niall I said that, is that we have an executive order the president has signed that says all data by default is machine readable and open by default. It's your data. As part of the American public, it is your data. You contributed to it, we need to give it back to you. On the side of healthcare data, I think we just need to call a spade and draw the line where it's appropriate. It's your data, period. It's your data. Now, there's all sorts of other things. People say, well, what about test results, CLIA, and all those things? There's a definition of what data is, and how do you build the product experience to get the data? And how do you discuss data and do those things? You get access to hurricane records, and nobody flips out anymore, even though 20 years ago, it was unacceptable to give the spread of where a hurricane goes, because people thought the public can't handle that. They're too stupid. We've moved from that. The same way we have to move to that it is your data, you should have access to it. If you're in a hurricane and you've lost your home, you should not have to wait in line to get your IRS records to go get a service that is part of the social contract with the government. You should be able to do that on your mobile phone. You shouldn't have to wait if you're a foster kid to go figure out what your immunizations look like, or your health records, or your school records. That should happen automatically. We live in a world where that exists in people's emails. It exists in backroom servers. We need to make that open up for everybody. That's what it means to have a responsible government that is servicing the public.
Are you saying more startups gravitate towards using that data? And how does that data then, so we have all this data, but how does it actually help the patient or any healthcare customer?
So I'll just say that there's a conference, the Health Data Palooza, and it just is growing every year, and it's a way for people to present what they're working on, and there are so many entrepreneurs, and actually people from all over the world who come to see what the U.S. is doing. We have an agreement with the NHS over in the UK, and we had a delegation from India this year, and people are looking at what we are doing, because we are really leading in a lot of ways in terms of how we free the data so that people can, as you say, it's kind of like taking the temperature of the patient, and the patient is the healthcare system, and you can drill down into it. And I wanted to follow up and say one innovation that we're doing is to create communities around the data. Open FDA is doing this, as well as a new program led by one of our entrepreneurs in residence, David Portnoy, on, we call it demand-driven open data, and ddod.us. And it's a way for people, for entrepreneurs to come to us and say, there's a data set that I need that is not yet open. And this is why I want it. And it's a way for people to explain why they want it, and then to actually garner support for it online, to make it more open, because we really want to have a customer service orientation. And that comes from the top. That comes from President Obama. That comes from Secretary Burwell, wanting this to have a customer service orientation. And that's the orientation that we have around health data.
I mean, part of that is like, go ahead.
I was just going to add one thing here, which is, the way to figure out the healthcare system, if you're someone like me out there who doesn't really understand the space, the best way to do it is actually to jump either into an entrepreneur in residence type program, like like in Susannah's organization, or somewhere else inside an agency, and sort of live it. Now, the caution is you might get in, you're going to turn out you love public service, and you're not going to go back. One of the things that we found in this process, because the innovation, the people who innovated this stuff were these kind of EIRs in these teams, these people who are coming in and instigating, along with people who've been saying, I've been trying to do this forever, help me make this a reality. Where we are still missing from your point of like, why isn't this benefiting the patient, is if we look at the blue button type efforts or healthcare interoperable standards and these things are massively subpar for the world we live in technology services, one service to another. We're very fixated on saying a patient should have access to the data. Most patients, how many people here have actually tried to get their health record? I should have known this health conference. It's pretty good. Kudos, right? But most people, you go to most people who are like, really, you can do that? and part of what you do is you don't really want your record. You want your record to go to another system. And if you start digging in and looking at the technical schemas of how that is to work, we really need a lot more technologists to help say, like, this is actually what a service-oriented architecture looks like. This is how we build it with security intrinsic to the way we do it. All these other things, that's what's going to enable the ecosystem to have a firm foundation on which to build. So we're off to a good start, but we got to do a heck of a lot more.
Well, I mean, besides, of course, speaking here at this summit, I'm curious, how are you getting the word out? How do you connect with entrepreneurs?
So what day is it? In what city am I in? So a lot of what we do is try to do outreach, and actually, since the work that I do at HHS Idea Lab is both public-facing and internal, I actually have a communications challenge on both sides, in that I want to recruit entrepreneurs and innovators to come to HHS and also to know about and use our data sets. That's wonderful. But I also want to lift up and work with people inside HHS. So I'm spending time with the CDC and the NIH and FDA and other sectors. But it really is, we want to tell this story. And we want to tell stories of success of entrepreneurs who've really made a difference and frankly made some money because of the health data that we've been able to surface and make available.
One of the things that we're focused on doing is using very specific projects to show the gap and figure out what exactly needs to happen to make that happen, to make the reality that we know is very tangible. It's not some wild off future world. It's right around the corner. One of those is precision medicine, which the president announced at the State of the Union. And that idea is, we got the genome. Why don't you see the benefits of your genome? Why don't the genetic code? Why aren't you seeing that? How do we make that go from a research aspect all the way to clinical care and benefiting everyone? And part of that is bringing data scientists, technologists together. Number one largest healthcare system in the government, VA, Veterans Administration. Number two, DOD. Number three, Bureau of Prisons. Who would have figured, right? We have these different systems. And so one is the government's a buyer. And so we have to figure out how do we align our as a buyer. Two is, if we look at the bare minimum technology that's required to make something like precision medicine happen, the mission and the goal of precision medicine is to enable the 21st century research platform that is going to enable patients, participants, providers, and researchers. In order to do that, you need a set of technological sophistication that if we get that right, it'll benefit all these other systems.
Oh, I was going to say that what I'm really interested in precision medicine is yes, the genome, but I know that you'll probably agree with me that the other thing that's wonderful is to have a focus on the phenotypical data, because so much of the lived experience of how a disease progresses, your genome is kind of the weather report, and the phenotypical data is really what's happening. And I think to understand that what technology has done is sort of opened up the funnel of information, so that it used to be that industrial strength information, we would really only get a filtered drip. And what my colleagues at the National Library of Medicine have done is opened up through PubMed access to publications, and we're doing even more of that. And access to genomic data. But we also need to recognize there's a whole wellspring of data that's coming up from patients. And how are we going to open up the funnel so that that is able to come up into the clinical system and up into the research system? And it has become a buzzword that patients are the least used resource in healthcare, but we really need to understand it as a data problem, that there is so much to learn from patients' own experience with drugs, patients' own experience with treatments, because we're all constantly engaging in N-of-1 trials on ourselves, and we just need to recognize that that's data too.
I mean, everything you've said in the past half an hour, 40 minutes we've been here has been really fascinating, and it sounds like you're making a lot of progress. How do you know the next administration is going to be as supportive of some of these things that you're doing?
I'm not worried about the administration. I think everyone that comes into these roles is a true patriot and tries to get the things accomplished. The place where I'm fundamentally concerned is two dimensions. One is that we just don't make fast enough progress to benefit and fill the gap on the hype cycle, because it's not a hype cycle. It's actually very near, but it feels like a hype cycle and a big gap just because of the delta on all these sort of silly issues that just is death by 1,000 cuts. The other one that is Congress. Is the Congress just needs to do its job and get us a budget and get it signed off, and we need to move on to doing our work.
This is like digital services in particular, or health?
Just meaning, across the board. So we're facing a government shutdown next week, and we shouldn't. If the vote goes to what's called a continuing resolution, we'll just be able to move forward on existing programs only, none of the new programs. Precision medicine, those type of efforts will not be funded. So we have this great stuff. We've made tremendous progress of what to do, but then we're not going to put it into reality. We'll just have a bunch of spreadsheets and paper and schematics and all these other things. We won't actually have a reality. And so we need the Congress to really move and align with that to make it happen. And we know that no one disagrees about that this stuff is important, but it doesn't happen unless we collectively work all three branches of government, of the executive, legislative, and judicial together.
Do you think any of those issues could prevent, some of the talent from potentially staying in DC versus, them coming back?
From my perspective, the people who come in as entrepreneurs or innovators in residence, for example, are coming in for a tour of duty with the government to solve a specific problem. And they're passionate about that problem. And that's nonpartisan. So when we look at a specific problem that we know is really holding back healthcare in a certain way, it doesn't matter. It's not a partisan issue. We have to solve that, and so in that way, that really is true patriotism. That they're coming in to serve our country and solve that problem. And that's why it's such a pleasure to work at the agency level, since I do get to work with people who started their careers in public service. And to me, they're also the heroes of this story. That they're going to be there, as administrations turn over, we still have these wonderful people. HHS is one of the larger agencies, 75,000 people, and the vast majority, it's not political. These are people who have dedicated their careers to public service.
Yeah, I just want, there's always this view it's like, oh, look, we're up here and we're the reason the government's changing. This is just not true. What is true is we are an excuse for somebody else's projects to have life and to become, to create the change that it is. The most important thing that I found, at least in my experience, is when I'm in a program or I'm trying to do something, the number one person I'm trying to find is the person with experience and wisdom, the person that knows how to see around corners and figure things out and just say, psst, over here, do it this way. That person only gets there through years of service. And once you're able to really work with them, they are the force multiplier, and they're the true heroes. They are the true heroes that are in this fight, and they've dedicated their whole career to doing this. And we have to do more to not only uplift them, but to celebrate them.
To that point, what do you think Silicon Valley can learn from the U.S. government right now?
Number one is how to hire a diverse workforce and how to empower a workforce that's diverse. Yeah, it's true. I mean, look at the president's cabinet. Not only the leadership, but all the way throughout the organization. It's extremely diverse. We have 250 million people. If you can't find somebody in that 250 to fill the job, I mean, that's on you. There's something wrong with that. The second is, Silicon Valley, I think, has done a pretty good job of this, but when you learn to wake up, the Secretary of Defense, Ash Carter, says this really well, there's nothing more powerful than waking up knowing that you're part of something bigger. And when you are working on a problem that is bigger and works more for that long-term benefits of overall society, you can't stop people. And I think what we have to remember that, are we dreaming big enough? Are we just dreaming for an exit? And I just can't emphasize enough how powerful it is to be able to walk into the building every day knowing that your job is to work for everyone in the American public, those that are counted, those that aren't counted.
Yeah, and I would echo that and say, that, and I actually think that probably most people here at this conference share this, that we want to work on stuff that matters. And what really matters is healthcare. HHS touches people from the beginning of life through the end of life and everything in between. And I have learned so much about, the true landscape of American health by working in the government. And you can really only get that view when you're embedded in the government.
Do you think we're going to see more talent like you go into the government? Are you confident of that?
I hope so. I think we need to, when we talk to somebody, meet them at a party or something, we don't ask them, did you go to school? Did you go to college? We don't ask that question anymore. We say, where did you go to school? We expect that you maxed out your educational ability to the benefit that you feel is necessary for your career. The same way, we should expect that everyone that is part of our country serves, that you should serve, whether it's at your local, the local city, your county, your state, your federal. That kind of service, that is part of the social contract. When we give back that way, you set not only an example for your peers, your children, but everybody else, but you learn. You learn about the country. You have an excuse to talk to anybody and everyone to understand what the problem is. And then you can take that back and figure out what next to build.
Yeah, I have to say, I have such a crush on our country that I really believe in it. I really believe that we are a symbol of what is possible in the world. And I want our healthcare system to be a symbol of what is possible. And one of the things I'm really passionate about is that I think we really face a significant problem with our aging population. And one thing that I would ask everyone here to really think about is, how are we going to meet this challenge? and I think of it almost like an Apollo 13 moment, that we're going to have to think about a way to hack our way out of the challenge that we have with an aging population, a rise in age-related disability, a rise in age-related chronic conditions. 95% of Americans want to age in place. They want to stay home, and yet we really don't have a workforce in place that would allow that. So what can we do to, fit the square peg in a round hole? And what can we do to engineer things to allow people to age in place with dignity? I think that's one of the real challenges that we face, and it's not just a software problem, it's a hardware problem too. So think about assistive devices. Think about the ways that manufacturing is actually coming into healthcare in a really interesting way with the maker movement. And that's the passion that I really want to bring to the next 15 months.
So we only have a few minutes left, but I want to leave on one note, which is, what was the most surprising thing for both of you after joining the government?
I got one.
Okay, go for it.
Okay, so I felt like an exchange student for the first 2 weeks because people could speak in whole sentences of acronyms, including a verb. And, and I'm now at the point where I catch myself. I'm able to say a lot of the acronyms, but that was the biggest surprise to me. It's like a cliche, but it's real. The acronyms are real.
My mobile device came with a keyboard.
I actually had to have somebody show me how to answer a call on the BlackBerry.
I did say the name of the device, just for the record.
Awkward.
Well, thank you guys so much. I really appreciate your time, and thank you so much for sharing everything with us.